Good evening and welcome to a special edition of The World Today. A word for viewers: because of the sanctions against Venezuela and the deliberate chaos that is being created as a result of US interventions, we cannot broadcast to you as regularly as we once used to do. We will make sure we stay on air somehow or the other, but we will be less regular. Today we have a very unique person in the studio, Professor Abdul Bari Khan, one of the founders of the Indus Health Networks, a network of hospitals created to offer free treatment to the poor. Because in a world beset with wars, with terrorism, with all sorts of natural disasters, sometimes it makes sense to tell a good story. And this story concerns Pakistan, a country which has been on the front line now of the war against terror, so-called, which has suffered many, many attacks, both by terrorists inside, on the borders, or by drone attacks by the United States, where women, children, innocents have died. This has been reported. What has rarely been reported, though is beginning to become a bit more prominent now, is what has been happening on the front of health and medicine in Pakistan. I was astonished several months ago to hear from a friend that a group of young doctors, now getting on, but when they set it up, had decided to create a national health service free for everyone, designed largely for poor people in Pakistan. This is an unusual story, because in the West, the health systems are now under heavy attack by private firms, and privatization of health services in Europe is once again on the agenda. Whereas in Pakistan, a group of private individuals have decided to raise money and set up a health service, so far with limited support from the Pakistani state and the various governments have been, who've been in power for many, many years. Professor Abdul Bari Khan, welcome.
Thank you.
It's a real pleasure to have you. Let me start by asking you, when this idea occurred to you, how old were you, and how did you go about bringing other people into it?
I graduated from Dow Medical College and attached to it as a civil hospital, which is a public sector hospital.
In Karachi?
In Karachi, where bed and doctors were available, and basic medicines, the rest patient had to buy out of pocket. So the poorest of the poor used to come to that hospital from Karachi, from interiors of Pakistan, from Afghanistan and Iran. So every patient had a story, because to just getting simple operation, they had to sell their cow, their goats, their belongings, and everyone had a story. And we were trained in that hospital. So when we were a student group, formed an organization by the name of Patients Welfare.
What year was this?
It was 1979. I joined that organization in 1980. Up till 1981, the source of blood in Pakistan used to be the professional donors who used to sell their blood. And they were addicts, and they used to sell blood once or twice a week. A normal healthy person can give once 3 months. Everything was there except blood. Hepatitis, because they were addicts. So
it was the blood was completely infected.
Completely infective. That is hepatitis, HIV, malaria, syphilis, and above all, it had a very low hemoglobin. So they used to give blood from one vein, and the other vein used to have a drip going into it, so to compensate. In 1981, they went on a strike to increase, demanding to increase in the remuneration for what they sell.
Who went on strike?
These blood donors. So we as a student, because that was the only source of blood, we lost many patients. But that was a blessing in disguise. We decided, we can't be hosted to these people, let's make our own blood bank. So in 1986, Karachi saw the first terrorist attack. There was a bomb blast in downtown of Karachi, that is Bori Bazaar. We lost many patients. I was doing my house job. So I still remember that I had to dig out a dead body, injured from dead bodies, and to treat them on the floor, The emergency department of civil hospital was very small. Then we decided to rebuild the emergency department of civil hospital by donations. So for the first time, we used school kids, gave them money boxes. At that time, we raised about 3.6 million rupees, out of which 22.4 million were raised by these school kids. 300,000 were in the form of coins, 5 paisa, 10 paisa, and 50 paisas. But it was the first time we interacted with the bureaucracy, the PWD, Pakistan Works Department. They created a lot of obstacles in our job. So a day before inauguration, we were standing in front of the emergency department, so with our friends. So I shared with them that one day we'll make a hospital which will provide quality care free of cost. So the dream of that hospital was seen in 1987. We think dreams are those which are seen while we are asleep. Actually, dreams are those which keep you awake. So after that, we all went for post-graduation. My friends went to UK, USA. I stayed back in Pakistan.
You never traveled abroad?
I never traveled abroad for post-graduation. So my father was paraplegic, so I had to look after him. So I went to National Institute of Cardiovascular Diseases, a cardiac hospital in Karachi, for doing fellowship in cardiac surgery. When I went there, there was 3 years waiting list for cardiac surgical operations, and we knew more than half of them will not come back. There were 2 operation theaters and 10-bedded ICU. So my mentor, I told my mentor, Sajjan Rahman, that people are there to help us out, to give medicines, money for medicines, for heart valves. Then he suggested that if we increase the infrastructure, then it will benefit the masses. So we added 2 operation theaters, and ICU was doubled, 20-bedded ICU, and the waiting list came down to 6 months.
Tell me something. I mean, this is an astonishing story, but why have state hospitals, for whom money is allocated in the budgets, or at least it used to be, done so badly?
2 things. Basically, first of all, the allocation of the health budget is not appropriate. It is 0.9% of the total GDP going to health.
One of the worst.
And about 80% of it's going into the salary.
So 80% of the health budget goes to pay salaries.
So there was only 20% for consumables for the patients. So, and out of that also, majority of it is filtraged, resulting in corruptions basically. So people had to buy. So that was one of the major reasons that the state hospital didn't work.
Let's return to the Indus story. So you were saying the first thing you did was to set up a blood bank.
Yes.
with blood that could be separated and used and was not infected blood. And from here, what was the road to setting up a complete hospital, not just a blood bank?
After the blood bank, as I told you, I established the cardiac surgery department in 2004. Yeah. In 2004, my colleagues who went abroad for post-graduation, they came back. So we regrouped together in 2004, and I told them that we had seen a dream and reminded them that we had seen a dream in 1987 and it's time to realize the dream.
And how many of you were there?
We were four.
Four of
you. So, and we were four doctors, and then we had some architect and project engineers which were involved in the emergency department. So now they had their own offices. So we regrouped together and we said, now it's time to build the hospital. So we started looking for the land. So fortunately, we came across a hospital where expat Pakistani doctor from Abu Dhabi, Dr. Nazir Qazi, he acquired the land in Ukurangi area and wanted to make a hospital for not-for-profit for the poor people. So he acquired the land, the nursing college was established, the building for hospital was about to complete, but the security conditions in the city was bad. So, and there was some conflict among the trustees, so he had to left the country. So common donors who used to give money to me also, and who used to give money to Islamic Mission Hospitals, they asked us, why don't you take over this hospital? Then we negotiated with them and we came to an agreement in 2005 that we'll jointly run this hospital. And in 2005, May 2005, we started work on that hospital. We actually stripped the whole building, just retaining the structure and renovating the whole building. We had no money, but we had firm belief. It's a faith-driven organization that for God it is nothing. It maybe appears a humongous task to us, but for Allah, He can say, be, and it happens. So we started the work and asked the contractor to give their bills, and we will ask people to donate.
So work started on the hospital to build it before you had any money?
Before we had any money.
So you raised the money as
the work
by sending the bills to people. It's amazing.
And in 2007, we started the 150-bedded hospital in Karachi with a motto of providing quality care free of cost.
So how did word spread? Through word of mouth? That there's, for poor people, how did they find out that this hospital was there for them and they wouldn't have to pay anything?
It was spread by word of mouth, and the donation was also collected by word of mouth, basically. We went to different donors, collected donation from different people, and then we came up. The first donor, who used to be, basically he was a businessman, and he used to live in Thailand. So he used to give money to me on different projects. So when we were making this hospital, so I met him and I asked him that we want to make a hospital and I need his help. So he was basically he was sarcastic that making a quality care hospital and running it free, we might be able to make it, but to run it free, he had serious doubts about it.
Well, I don't blame him.
My answer was that he asked me how it will happen, and Allah will do it. God will do it. He said, we have believed that God will do it, but God is not going to throw money from the sky. So there should be someone who. So I took the leeway and I asked him, you will be paying, you will be helping me out. Okay, then how much you are serious about this? So I told him, I can't believe that one can't have a mission unless he is ready to sacrifice his money, his life, and his dear ones. So at that time when I was making the hospital, the Department of Cardiac Surgery and Civil Hospital, my salary was about 1,500 rupees.
1,500 rupees a month?
A month.
Which is translated into dollars?
At that time, it used to be $150. And if I would have done a private open heart surgery, the fee which I would have got would have been equal to my 1 year's salary. So, but I was not indulged in private practice, but I wanted to have a mission to make it. So then he said, okay. And his first commitment was 100 million.
Was?
100 million rupees.
100 million rupees.
So that was, at that time it was $1 million.
$1 million.
$1.5 million because it was 60, $1.5 million. And it was basically 20-25 minutes conversation only. And when I was leaving the hospital, when I was going to this meeting, I had the bills of contractor which were about 10 lakh rupees, 1 million rupee.
So one meeting got you the money so you could pay the builders and constructors.
Yes, and then we had to basically, we spent about $350 million, rather 350 million
on
rupees
building.
On just building, renovating the building. And in 2007, we started this 150-bedded hospital.
Given that the problems are so vast, that there are so many people in that country who, you know, it wouldn't even occur to them to go to a hospital in many cases. How did people start coming in to the hospital? What was the process?
The process was basically simple. The doors were open to all. Everyone can come in. There were two ways of entering to the hospital. There was an emergency department where you have to go in an emergency, and then there was a planned outpatient department. So you have to come up in the family medicine clinics, and where these patients are triaged and they were referred to respective consultant if need be. Majority of them were taken care of in the family medicine clinic. Initially, the numbers were less because those people who wanted to come to the hospital, but they were apprehensive that there would be a lot of charges, how can they pay it? Once they start using it, and when they ask how much do I have to pay, so no pay, you don't have to pay, it's free, it's totally free. So it's true. The salient feature of our hospital is a totally paperless hospital, and it's totally cashless hospital. Cashless to an extent that there is no cash counter. So there is no way of paying it. If you want to contribute, there are donation boxes. You can put in a rupee, you can put in 100 rupee or 500 rupee, whatever you like. But no one will ask you for the bill. No patient is given a bill.
And medicines are free?
Everything. Once you enter to the hospital, from syringe, a rupee syringe or 5 rupee syringe to 100,000 rupee stent, all free. And also the meals. So you don't have to, you just have to get admitted there, and then everything is taken on in the house.
But Professor, tell me this, once word spread that this was going on, how did you contain the numbers of people who wanted treatment?
Basically, the response was overwhelming basically. It's because 150-bedded hospital in a population of 20 million people
in
Karachi only is a micro drop in an ocean.
Yeah.
So the catchment area is not Landi Kurangi, it's not Karachi, it's whole of Pakistan, rather adjoining area of Afghanistan and Iran also. So the waiting list start rising as you have in any hospital. So, but for some procedures, this is longer. So we on a daily basis, we take a fixed number of patients which we can cater. So we don't allow a second patient on the bed, because in the public sector hospital, you can find 2 patients lying on one bed, sometimes 3. You can have 5 kids in one cot, which we don't, because we would not like ourselves to sleep with another patient, and it doesn't basically, it's cross infection we cannot control with 2 patients lying on the same bed.
And what is the progress report to date? There are 12 hospitals?
Yes, it started with a single hospital. Now
in Korangi.
In Korangi, and when we were starting, people were skeptical that whether we will be continuing to run on the same basis, that is free of cost. So 99.9% people told me in some time you will be starting charging people. So someone gave me a month, someone gave me 6 months, and max 1 year. Now we are about 11 and a half year old. Not a single patient has been refused treatment because of lack of money. So we started with one hospital. Now, as you said, it is Indus Health Network. So we have 12 hospitals across Pakistan, and we are into the public health programs in 41 districts of Pakistan. So when we were starting in 2007, people were saying, why are you doing it? It is basically the government's job. It is state responsibility to give health and education. Yeah. But in 2007, we were about 60-year-old. Pakistan was 60-year-old. And the civil society has agitated, made strikes, and nothing happened. So we thought, we'll make a model, a parallel model, which will work. And a time will come then when the policy maker will ask us, will take our advice. And within two and a half years, or rather 3 years' time, we were approached by the government and they wanted their hospital to take it over by us and run on a private-public partnership. So out of 12 hospitals, 8 are government hospitals given to us, where funding is provided by the government. We manage it. They monitor it, we manage it. And they wanted more.
So they are, so the government is contributing financially?
Yes, contributing financially. Those hospitals which they give it, which is their hospitals, but we are managing it, 8 hospitals.
So what is your total budget for these hospitals?
So we have about total budget, operational budget is about $120 billion.
$120 million.
Out of which $40 million comes through the government, which is for the government managed hospitals. Then 40 million comes from the disease-based programs from Global Fund, which is TB and malaria and HIV. We have to raise about $40 million. And 92% of that $40 billion comes from within Pakistan. And 70% of it is in the form of zakat. 30% is in the form of donation. Pakistan's health indicators are bad. So we are very bad. We are basically number 1 in everything, basically. We are
infant mortality,
maternal mortality, stillbirth rates, or then also the stunted growth, and then also basically the poverty. If we take $1 a day income, it becomes about 21% of the population lives below poverty line. And if we take $2 a day, then it goes up to 50%. So 50% of the population living below poverty line. So there is also, as you know, there is movement of population below and above poverty line. In US, the reason for coming down the poverty line is divorce. In Pakistan, it is health.
But at the same time, as these public service networks are being constructed, we have state-of-the-art hospitals in every city, but just for the rich, people who can afford...
Yeah, private hospitals.
Private hospitals.
So basically, if we divide the state of population into rich, so about 1% of them, they will not get treated in this country, in Pakistan.
They will come
they will go abroad. Whatever they need, a small the hospital, so they can be stabilized and they can move out and get it done in any part of the world. Then there are people who are rich, rather upper middle class. They will all go to the private hospitals. So in Pakistan, then we have lower middle class, which goes to not-for-profit hospitals. And these are So our target population are the poor ones, very poor, who are eligible for zakat, and the poor who are not eligible for zakat, and the lower middle class population. Anyone who has a salary of about 200,000 a month, and he has 2 kids, and he lives in a rented house, if God forbid he gets a heart ailment, he cannot get treatment. So either he has to borrow or he has to sell his belongings. And these are the people who don't ask people. They just linger on with their treatment, and they just ask the doctors just to sterilize until they are free of, they get their daughters married, and then whatever happens to them.
You know, your 12 hospitals, or the hospitals you have helped to create, are a drop in the ocean, given the size of our population. I mean, is there no possibility of setting up, for instance, in villages and in smaller towns, not full-blown hospitals, but clinics with doctors who can serve, you know, basic needs, not perform the big operations, but just make sure that people don't drop dead for no rhyme or reason?
Actually, unfortunately, the infrastructure-wise, Pakistan had a very good infrastructure. We have taluka hospitals, we have district hospitals, but unfortunately, they are not populated.
There's no one to
look after.
It's empty buildings.
It's empty buildings. So
shocking.
Unfortunately, and we don't have an organized healthcare system. So when we analyze our data of Karachi Hospital, and we found out that about 53% of the patients shouldn't have come to that hospital. They should have been taken care of
locally. Yes.
So now we are into making our own primary health clinics across Pakistan. Unless you have a primary health system, family medicine clinics, you cannot cope up with the challenges of health. About 70% of disease are waterborne. People doesn't have an access to clean drinking water. They don't have sewage systems. So it's health as a definition is not only the you are diseased mentally or physically.
It's the lack of a social infrastructure.
It is social infrastructure also. It's socially, environmentally also. So holistic approach is needed. So we are now into going into providing water also. At this moment, we have basically identified 12 districts of Pakistan which have the worst health indicators. So we are signatory to SDGs, basically, mainly Sustainable Development Goals. So where health, poverty, and there are about 11 indicators.
How long do you think it would take to improve the social indicators, just in terms of health, cut down the infant mortality rates, the women dying, giving birth, etc., etc. How long would it take to just bring these down? Because they've been at a peak now for decades.
Yes. So if a collective, collaborative action plan is done, I think so by 2030 we should be. It will start coming down. So if recent survey, if we see there has been some decline, but it is so negligible. But this process has to go on, and the action plan has to go like this. So as we were saying that Pakistan has everything bad indicators, but there's something good also in Pakistani. We are one of the nations who are a philanthropic nation. So as I told you that 92% of our revenue is generated from within Pakistan. And there are other models also. It's not only Indus Hospital, there are Shaukat Khanam Hospital, there is SIUT. Edi Saab was doing a great job.
Abdul Bari Khan, over the next 10, 15, 20 years, what is your hope for Pakistan on this front?
If nothing happens at a state level, I see Indus as National Health Services of Pakistan.
Free.
Free.
It's a wonderful dream.
Yes.
Thank you very much for having been with us today.
Thank you, sir.